Hello and welcome. I'm Dr. Adam Dorsey, a psychologist in Silicon Valley and the host of Super Psyched, a podcast dedicated to supercharging your life. Each episode contains fun, high-quality interviews with experts looking at psychology from all angles. Super Psyched is your tool to get more of what you want in your life and less of what you don't. A struggle for any parent is seeing their child in pain. Even when the pain is small, we tend to have an impulse to fix that pain. And when the child's pain is extreme, that impulse can skyrocket. Yet, as any parent can attest, there's only so much help we can provide, which can leave us feeling helpless. How can we be most helpful even when we can't fix things? How can we differentiate between adverse experiences that will be short-term versus ones that may linger and cause harm long-term? Fortunately, I know just the woman to ask these and many other questions to help our children through adverse situations. Dr. Melissa Goldberg Mintz is a clinical psychologist with expertise in treating children who have experienced trauma. She's also the author of an important book called Has Your Child Been Traumatized? How to Know and What to Do to Promote Healing and Recovery. So listen in as Melissa and I talk about how to help your children through adversity and trauma. Dr. Melissa Goldberg Mintz, who has asked me to call her Melissa, welcome to Super Psyched.
Thank you so much for having me. I'm so excited to be here.
All right, on. And you've written such an important book for this time. How did you decide to write about this?
So I have been working with traumatized children for pretty much my entire career and was looking for a book like this and couldn't find it. And as a parent myself, I've read a lot of the books out there, like the Dan Siegel books on how to raise resilient children. And there are so many wonderful books on that topic, and I love them. But I found myself wondering, what about the kids who have already been traumatized? And there are some books out there that go into very specific types of trauma. And then there are some books out there talking therapists through what to do with traumatized children. But there wasn't really a great one that was comprehensive, written for parents. So how I decided to write it.
That's fantastic. And what are some of the basic things that parents really need to know, just kind of as a starting point, about trauma itself, as well as how it may show up specifically in children?
So I would say the first thing to keep in mind is that trauma is not the event that happens itself. That is something that we refer to as an adverse event or potentially traumatic event. And what we know about these adverse events is that the majority of children in our country will experience at least one of them before they hit the age 18. So these are things like car accident, abuse or neglect, a natural disaster, witnessing a parent abuse substances, anything like this. So more than half of the children in our country experience at least one. So that's kind of some sobering data. But the good news is that most of these kids can go on to heal naturally, even without therapy.
And that's very heartening to hear that most of the time, the inherent resilience in children allows them to go about their lives in spite of the adverse childhood event. I'm wondering, how might parents inadvertently actually get in the way of that healing process by actually trying to be helpful? What are some common misconceptions that lead a parent to do something that might be contraindicated?
Sure. So, oh my goodness. So what might that their own anxiety, which is perfectly normal. When something scary happens to your kid, it's really scary as a parent. So I would say, don't fault yourself too much if you're one of those very eager type A parents. And what I know is that at least once a week, I get a call from a worried parent who is so convinced that their child has been traumatized. And then I meet the kid and the kid's doing just fine and isn't in need of that therapy. So even something like a young cousin of theirs died unexpectedly. But, maybe this was a cousin the kid didn't know so well. And so it doesn't hit home quite the same way that it might for a parent. So I think that's one thing to keep in mind. Also, sort of insisting that a child talk about their feelings over and over again. I mean, it's great. We want kids to be able to talk about their feelings with their parents. but it's a balancing act. And what you need to think about first is how to put your kid at ease and make that space for them to feel comfortable to share with you.
That's a really good one. So our own anxiety as well, this kind of hypervigilance that many of us, myself included, may have at times. And it sounds like another thing that parents may unwittingly do is that they may engage in all types of behaviors that could actually be contraindicated. What else might a parent do? For example, I would think that parents might just say to their children what was said to them, like, suck it up, it's not such a big deal, or think about something else, or you have to keep talking about this. Versus, of course, the opposite, which you just shared, which is talking about it too much and really probing and trying too much for the feelings when actually that's actually going to be aversive to the child.
You're so right. And I think even milder than what you were suggesting, saying something like, oh, don't worry about that, it's going to be okay. That sounds fine on the surface. What we know is that a kid might experience that as dismissive, even if this is not related to trauma, something like a kid feeling really anxious about who they're going to sit with on the first day of school for lunch. Oh, don't worry about that. You'll find someone, honey. Those worries are so real. And if we can put ourselves in our kids' shoes, we can remember what that was like too. So even though, yes, we have the wisdom and knowledge to know it will ultimately probably be fine, what we also need to balance out with that is the fact that it feels really uncomfortable for them in this moment.
Yes. So what you're kind of saying parenthetically is maybe empathy would be indicated here.
Yeah, absolutely. Empathy. Yeah. And just being curious about your kids' feelings and trying to put yourself in their shoes. Absolutely.
So let's hear what that would sound like. What are some things that a person could even just copy and paste from you when they're trying to be more empathic or more curious, certainly more helpful when a child is going through an adverse situation that could lead to trauma later on or not? But regardless, it's an adverse situation. What could they say?
So let's say, I'm just going for an ordinary one here, but let's say a kid was in a car crash and, it was the night after and they had a nightmare. And I'll add that having a nightmare the night after a car crash, that is not indicative that this kid is going to
right.
Yes, see, that's totally normal to have a nightmare the night, even that week after, totally normal.
For sure.
But what a parent could say is like, oh gosh, when the kid's recounting their nightmare, that sounds like it was so scary. I'm here with you. And then also something like, that's pretty normal to have nightmares after something scary happened to you in the day. So normalizing what they experience rather than saying like, oh, that's okay, or try not to think about it or get over it or anything like that.
I often say that if my work was a game of Family Feud, the number one answer of the people I see about what has caused harm on average has been not feeling seen, not feeling noticed, not feeling heard, not feeling understood. And what you're describing is a humility that parents can have to not be the fixer, but instead just kind of be the witness.
I love that. Yeah. The witness, not the fixer. I'm going to take that if that's okay.
By all means, it's yours.
Yes, absolutely. Yeah. And there's a time and a place when a kid might need help fixing something, but so often what they need first, even if it's a situation that does need fixing, what they need first is the witness, someone to be there in that with them.
For sure. Now, one of the things that you spoke to, and we're going to get a little deep in baseball here, but I think in a way that anyone will be able to understand, is that having a nightmare or nightmares for a short period of time is not indicative of it turning into a full-blown PTSD response. What are the things that would be concerning? When does it appear that things are actually going a bit sideways and that help from the outside is probably going to be needed?
Sure. So I can take you through what I look for as a psychologist, but I also want to share some guidelines that I tell to parents. And so my less clinical guidelines that I talk to parents about are, we're just really concerned about a change in baseline functioning. So did you have a super social kid who loved going out and playing basketball with friends on the weekends and was hard to spend time with just because they were so busy with social plans that now just it's around the house all day? That would be a concern. But if your kid was more of a homebody, then it's not as concerning if they're continuing that behavior. Did you have someone who was an excellent sleeper, ever since they were a baby and then now is either oversleeping or having a hard time falling asleep or having nightmares or being afraid of going to sleep or anything like that? So change for baseline there. Or with eating habits, school functioning, all of these types of things. So a change from baseline that is enduring. So not like a little blip in the radar, not a day, not a week, but when something lasts for, I'd say a month or longer, then I think it would be time for some therapy. Now, of course, there are cases when something terrifying happens and it is so unsettling to that kid, even the first week after, that they are just so distressed that you want to get them help right away. And in those cases, when there's some acute stress, then you don't have to wait.
Yeah. You're differentiating between acute and long-term sustained stress. And I love that, really empowering the parents. They are the experts in how their children behave. And a change in baseline behavior is such a nice nugget to drop like that. One of the things I also know about you is that you and I both recognize the role of sleep as being something that can really help, and the absence of it can really harm. I would go so far as saying it virtually helps every cognitive, emotional, motor, and every function of us being human. It has plays some part, and it plays a part in attending to trauma. How might sleep actually factor in, and what could parents do to help their children if, unfortunately, the impetus for them to engage in better sleep hygiene is the traumatic experience itself, or preventively begin to exercise better sleep hygiene so that children will be more resilient in general? What are some of your basic ideas on that?
Absolutely. And I just want to say, I fully agree with you. If you can't fix sleep, it's not going to get better. So for those acute stress cases, if a kid is not sleeping after experiencing something terrifying, I sometimes will encourage those really intense cases to consult with the kid's pediatrician and to think about medication just to help get them sleeping in addition to sleep hygiene practices. And then, of course, on that extreme end of things, people will have different opinions about this. But I think if your kid is not sleeping at all and something horrible and terrifying has just happened, that if you're okay with it, sharing a room or laying down with them until they fall asleep is okay. We don't want to continue these practices long term. But in the short term, if it's just to help your child get to sleep immediately following something terrifying, I think it makes sense. In terms of more long-term sleep hygiene practices, what we really want is a standard sleep time and wake up time. You know, the way I think about it is like if our kids have a little tired bucket, that tired bucket needs to be filled with tiredness in order for them to fall asleep. And if they stay up very late one night and then you let them sleep in the next morning, say it's a weekend, they're going to have a harder time falling asleep that next night. So we need to have regular bedtimes. A routine leading up to bedtimes is often comforting and calming. And then not having them get in bed throughout the day when they're not tired. Bed is a place where we do sleep.
And any parent would agree that getting their children to sleep is not easy. Many of the parents give up and say it's just not worth the fight. I would argue that it's probably very much worth the fight. Yeah. And particularly regarding this conversation, how might the absence of sleep exacerbate traumatic event? And how might the presence of sleep actually be something that aids the child in working through it?
Gosh, so when we think about some common behavioral changes that we see with post-traumatic stress, some of the things that get under parent skin the most are increases in minor and major misbehavior. So minor misbehavior being things like tantrums, whining, backtalk, that sort of thing. Major misbehavior being physical aggression, destruction of property, some of that scary stuff. And what we know is that even absent trauma, these things can increase with sleep deprivation. So if you add sleep deprivation to an adverse event and trauma, recipe for disaster.
Totally, 100%. It's funny. We think about babies and they pretty much cry for 3 reasons. They want to be changed, they need to sleep, or they need to eat. And if you think about that and how it still is present, like if we're uncomfortable, I have to go to the bathroom. If we need to eat, we get hangry. And if we haven't slept well, everything goes sideways, including our ability to be resilient. So I'm so glad that you're talking about this. You know, you see these kids who show up for an assessment. Parent believes the child has ADHD. And upon further research, you come to realize that the child is drinking Coca-Cola at 8:30 at night and there's caffeine there and they're not sleeping well. And it's actually the sleep deprivation that's causing the ADHD symptoms, which remit immediately as soon as better sleep hygiene practices are implemented. So I just think that sleep is such a big deal. So I'm so glad that you bring this into your education to the public as a trauma specialist. What is trauma, though? You've said kind of a little bit about what it's not. What is trauma? It's used so frequently, and even the word PTSD is used by the masses probably incorrectly. at times. But let's hear about your thoughts. What is trauma?
So trauma is what happens in the body after experiencing an adverse event if there's not that natural recovery. So when we think about trauma, we think about symptoms. So some of the symptoms we were just talking about. So difficulty with concentration can look like that, which is why sometimes sleep deprivation can look like trauma, or they can go hand in hand. But yes, so difficulty with sleep, nightmares, some of these intrusive re-experiencing symptoms. So having like thoughts or images pop up in your head about the scary thing that happened when you don't want them there, the nightmares and the flashbacks. Also avoidance symptoms. So trying not to think about or trying not to talk about or visit places or people that remind you of what happened, having negative thoughts or feelings about yourself, other people, or world. These sorts of symptoms are all things that are really wrapped up in trauma.
And I'm not trying to freak people out, but trauma left unattended can really have lifelong side effects, can lead to other coexisting, comorbid, concomitant issues such as depression, anxiety in various forms, sleep trouble, dissociation. And I'm just thinking about the high cost of not attending to it while it's small. So it's kind of a tightrope walk that you're describing. You don't want to be overly vigilant, but you also can't be super dismissive. And I guess I'm going to ask, how do you walk the tightrope so that you're not overly dismissive and yet not overly vigilant? You've kind of spoken a little bit about the empathy that a parent can rock and some other skills. What else might a parent do? Would they want to be better educated about what trauma looks like? Would they want to be better educated in terms of how to speak trauma as a second language, so to speak, so that they can be more conversant with their children? What are some skills?
Yeah, the first thing I recommend to parents is their own therapy. In addition to just that psychoeducation piece and learning about trauma, parents have so many feelings. When something scary happens to your kid, you're going to have a lot of feelings about that. So checking yourself and checking your own experience is probably the best thing you can do as a parent for your kid. But in terms of just learning more about trauma, man, there are some great resources out there. My favorite online resource is the National Child Traumatic Stress Network. So that's just nctsn.com. And there is a treasure trove of information on that site about child trauma where parents can just spend hours.
That is phenomenal. And I'll do my best to include that in the show notes. I'm remembering one of the very first times that I felt totally incapacitated to help my son. His favorite goldfish died. So my beautiful 7-year-old son was just bereft. And I experienced what so many parents experience, that hopelessness, that helplessness. What do I do? And what I chose to do, and I actually talked about it a bit in my TEDx talk about men and emotions, was that I acted as kind of a shepherd and a witness for him to allow him to go through the emotional experience. Just was with him. I validated him. I was empathic. And lo and behold, it worked. I mean, it's funny. We often believe that we have to do something totally magical, but it's really just that ancient skill of being with a human.
Yes. Oh my gosh. Well, I love that. And I can't wait to listen to them.
Aww.
That is so sweet. But I agree with you. Connection is the best medicine we have.
Connection is the best medicine we have. More evidence that you're a sister from another mister, because when I think about like the words that mean the most to me, they are vitality, connection, and a few others, but connection itself is really what we hunger for. And the joke, the paradox is we're more connected than ever technologically and less connected interpersonally in a true way that our brains understand connection. And what are your thoughts about that? What about the experience of going through a trauma and then not really feeling seen by the parent? Can you talk about the deleterious effects of not being seen?
So what I'll say about that is a lot of times I get the question, how can two kids experience the exact same event and one goes on to be traumatized and one healed? Like, what is that? And there are a lot of risk and protective factors, but in my mind, the most powerful thing is having at least one supportive, reliable caregiver, mom, dad, a grandparent, a foster parent, but having that one relationship, oh my goodness, just does a world of good. I think is the most powerful protective factor you can have.
Oh, so good. And that question about why would the same stimulus, the same trauma, incur vastly different outcomes to two different people? And there are so many factors to consider, and it would be impossible to really give a good answer. But one of those factors must be some type of resiliency in the genes it's themselves. I mean, we're seeing these families, all of whom are exposed to COVID, some of them getting COVID and some not. So in a similar way, I would imagine that, yeah, and you're nodding, like that traumatic event could incur, like that was the moment that I turned my life around. And for one person, and that was the moment my life got turned around for another person.
Yeah, absolutely.
Wow. Yeah, it's heavy stuff. I mean, you're a mother of two. So how has your exposure to clinical psychology and trauma itself changed you as a parent?
Oh my goodness. Good question. Yeah, it has a lot, to be clear about that. So I recently wrote an essay for Newsweek about my relationship with my daughter and how there's this memory that's been burned in my mind. Her crawling under, we have this glass coffee table that's very low to the ground to get a toy. And just as I was about to call out, "Careful, baby," I hear her saying to herself, "Careful, baby, careful, careful, baby." And it became her mantra because I said it so many times. I loved her so much. I was so anxious. I just wanted to protect her, probably like many first-time parents out there. But as she grew, she was just this very cautious child. And she did a great job making friends at school, but when we would go to the park for play dates, she'd be a little scared to climb up on the jungle gym and go to race down fast slides with her friends. And so some of that cautiousness was holding her back. So I think some of my own anxiety was inhibiting her in a way.
For sure. And I totally get it, but keep going.
Yeah. So I don't know. I think being a psychologist helped me to reflect on that and then decide to do something different, which is sit on my hands and hold my tongue when I want to say careful and instead praise her for doing more adventurous things. But yeah, so I certainly make the same mistakes that everybody else makes, but definitely have these issues on my mind.
Oh, for sure. And the hypervigilance. I'm remembering when my older son was old enough to walk up and down stairs, and we were at my buddy Bob's house, and I was tripping. I could not handle the fact that I couldn't control for his safety. And my buddy Bob said words that changed my life. He borrowed from Carlos Castaneda, the author, who said, and I'm going to paraphrase it poorly, something to the effect of, when we have a child, it's as if God has carved open our chest and taken our heart out to the world, vulnerable and exposed.
Oh,
and
wow.
Those words were actually very healing for me. It's like, okay, so this is the thing. This goes back probably till the beginning of parenthood. And I will watch my son walk up and down the stairs and try not to get in the way unless it's absolutely necessary. So I just think that's great. So what are some common misconceptions about trauma? You've kind of alluded to some of them, but let's hear just a little bit more as we're kind of wrapping up here.
Sure. So one common one I get really also stems from parental anxiety that my kid is forever ruined. They won't be able to have the bright future that seemed so promised for them before this terrible thing happened. And what I say to that is, of course, I'll say, yes, this thing that happened is horrible and terrifying. And what we know is that the vast majority of children heal from this and go on to lead happy, healthy, productive lives. So that is always a myth I feel strongly about correcting.
And one of the things you're speaking to, and you've spoken to before, is the trauma that happens to a child bleeds into the experience of a parent in as much as the parent may have a traumatic experience vicariously.
Yes.
And one of the hallmarks of PTSD is a sense that there is no future. And what you were describing just there is a parent under the impression that there will be no future for my child after this event. And that is something you try to disabuse people of.
Yes. Yeah, absolutely. Absolutely.
So my final question for you.
Yes.
It's the miracle question. And that is, if you had the magical powers to confer upon all humanity one skill or insight that would be super helpful, what would that skill or insight be? And how do you imagine it would impact the individual as well as perhaps society at large?
Okay. Could you imagine if we could give every kid out there a secure attachment relief caregiver? That would be it.
Okay, before we continue, a lot of people don't know about attachment styles or attachment theory. Can you explain what a secure attachment is? Because I totally agree that would be a huge gift.
Yes. And that's what's at the heart of my book. So a secure attachment, it starts in infancy. And if when your baby cries, they have the sense that you will be available and reliable consistently to them. And as they grow, it's the same thing. So if I need something, if I'm in distress and I cry out or I call out or I use my words or anything, will my mom, my dad, my grandma, whoever it is, will they come to me consistently? And I think that if every child had that growing up, this world would look so different.
Huge. And for those of you wanting to geek out a little bit further, take a look at the Still Face experiment by Ed Tronick. It's just 3 minutes of video that will change your life, and it will corroborate in just 3 minutes, very visually, what Melissa is talking about here in terms of a parent's ability to respond. What a great contribution to the field you're making, Melissa. I'm so grateful to you for writing the book. I'm so grateful for you for sharing your time. This has been edifying and a blast.
I totally agree. I wish we could talk for longer sometime. This has been fun.
Oh, right on. This is Dr. Adam Dorsey thanking you for listening to Super Psych. If you know anyone who might like it or who might benefit from listening, share it. And if you like the episode, please hit subscribe.